Hello everyone. Now, I thought what I would do today, as I've been sort of spilling my guts over the last week about this recurred prostate cancer, is I'm now starting to come to terms with it, get a little bit more technical about the situation I'm in, because I think that's much more helpful to people who maybe are going through what I'm going through, and maybe don't have that insight as to what I've got. And hopefully, because I do like to help people, and if we can help people cope with what I'm going through, the better. So first of all, let's just explain the premise of the video. I'm just going to do this as a person living with prostate cancer, recurred prostate cancer, a person that's got a background in medical law, so I've dealt with a lot of complaints about and legal claims of clinical negligence for misdiagnosed, late diagnosed prostate cancer, and ultimately I've also been I'll call it an ambassador for Prostate Cancer UK. Many years ago, directly after my operation 10 years ago, I got heavily involved and did some street talks and some media interviews and some online stuff for them, and I did some self-help guides for men post prostatectomy on how to deal with impotency, incontinence and fatigue. So just now that we know the premise, just to explain a little bit about my case, because that might help. So about 13 years ago, I started to struggle to not go to the toilet several times during the night, and then I started to struggle to go to the toilet when I needed to go to the toilet, and then I struggled to stop going to the toilet, urinating. This is obviously when I was going to the toilet, and then I started to have problems with erections and then with sex, and I kept going backwards and forwards to the doctors and saying something's not right, and for about 3 years I just got bounced back saying I wasn't old enough to have prostate cancer, and it was probably just a prostate problem or a UTI I was dealt with. I had many tests. I had a cystoscopy, which is basically a camera, and they put that down a man's urethra. And if you're thinking, God damn, that's probably painful, it is. And if you have to have a cystoscopy because you're watching this and your suggestion is to have a cystoscopy, you have the option of being anaesthetized with a general anaesthetic. I would heavily encourage you to have a general anaesthetic on the basis that a local anaesthetic was used on me, and it was probably one of the most painful things I've experienced in a long time. Now, other things that you may have heard that might need to be done with you if you're experiencing the same problems with me about urination, stopping, starting, struggling with erections and sex. Lower back pain as well was a problem. I kept getting a lot of lower back pain, and it was discomfort, and I got fevers, and I just felt sick. They may talk about a urodynamics test, which is where they fill up your bladder with a certain measurement, and whilst you're in a urology department somewhere, they will measure your flow, so how fast it comes out of the bladder. You pee into a machine, and they also then will measure how much came out of the bladder, so then how much is getting left in, and what they can also do is CT scans and MRI scans to have a look. Now, I had an MRI scan, I also had a CT scan, I had the cystoscopy, I did urodynamics testing, and I had digital rectal examination, I had several PSA blood tests done over a 3-year period, and all of those said that this was likely, once I got past the initial bounce back of some doctors telling me, because I do have a history of depression and anxiety, that this was somatization. So I was somatizing the condition of prostate cancer. That's another video that will come on my YouTube channel at a later date. Once I've gone through that 3 years, sheer good luck, meant that I bumped into my father in 2015 on the 5th of September, which happened to be my niece's birthday. And in conversation, it came out that I had been suffering these problems, and he mentioned that I probably would have prostate cancer just like him, which was a bit of a surprise to find out after 7 or 8 years of not talking to your dad that he had prostate cancer. But it was also a big surprise for me because I also found out that his brother, my uncle, had prostate cancer previously and had the prostate removed in the old-fashioned way. And so happens a week after that, I had a standard urology appointment to talk about this ongoing issue that wasn't getting any better. It was chronic. And during that consultation, I told them what had happened with my father. They then took that much more seriously, and they then arranged biopsy. That biopsy was taken less than a week later, and about 3 days after that, I got the call to come to hospital to talk about the results. I knew then from that call, because I worked in medical law then, that they don't call you to ask you to come up to hospital to tell you that everything's all right. They send you a letter and tell you to book back in to the various teams, urology. So I knew I was going to get bad news, so I was prepped, and rightfully enough, on the 29th of September, I was sat down in a room with my then partner and told that I had prostate cancer. My cancer was right-sided cancer, or Ardus carcinoma, and it was internalized within the prostate, so not a usual form of prostate cancer, as it normally grows on the outside of the prostate. Hence they do a digital rectal examination, because they can feel for irregularities on the prostate. This grew inside the prostate. It was right-sided. There's two hemispheres in a prostate, so the right and the left side, just like a walnut. You open a walnut and it falls to two bits. You've got those two sides of a prostate. I had what's called a Gleason score of 7. That was 4 and 3. It's scored out of 5 for each set of tests. And 4 is quite high, 3 is mediocre. But it did mean that it was determined that although it was just stage 2 at that time, it was determined that the scar meant it would rapidly grow into a stage 3, possibly a stage 4, because the 4 was the part of the cancer test that would suggest it would spread rapidly. Now, that meant 2 weeks later, I was in hospital and I was having I'll say the long word, it was a robotic, laparoscopic, nerve-sparing, radical prostatectomy. So that basically meant it was done by a robot, operated by a brilliant surgeon called William Ward. I will tag him in if I can to this, because he saved my life. And without his expertise and skills operating the robot, then who knows where I'd be right now. But he operated the robot. It's like a laparoscopic because it's keyhole, so you get 6 entry wounds, 3 on the left hand side of my belly button, 2 on the right hand side, and then 1 above the belly button. The 5 on either side of the belly button to put on the operating tools, etc., and the 1 above the belly button is what they call the entry wound and the exit wound. So that's where they go in, fill up with gas. You tipped upside down throughout the procedure, so all your intestines fall away from the area where they need to get in to get the prostate, and then the other, and then obviously that's where they take out the bits, the prostate, semivesicles in my point, and then obviously any other extra bits, tissue they need to take away. Obviously the other sides, as I say, they're just for the tools. I should have had about a 3-hour operation, but as they went in and seen what they were looking at, they realised that my prostate cancer had started to metastasize, i.e. it started to spread outside the primary site. That's what metastasization means, spreading outside the primary site of the cancer, and so therefore it turned into a 5-hour op. That's where the nerve sparing part came in, because they had to as far as possible, try and save the nerves that allow for me to get an erection. And ultimately, feelings around the groin, and for obviously bladder purposes and urination and continence. That was carried out successfully. I was poorly afterwards, but the operation was done. About a month later, I was told the histology of the prostate and the surrounding tissue showed what's called a clear surgical margin. So that meant that there was no found cancer cells in an area around the cancer, I think of a few millimetres deep, that showed that there was any cancerous cells, which is why then I got the news that I was in the all clear. That was just before Christmas 2015. I was told that, and that was a brilliant news to hear, obviously, because that's what we wanted. That was the intention of the prostatectomy, was because I was 41 when I got diagnosis. I was 37 when I started with symptoms. So I just want to make a point of this as well for any men that are looking at this and they're thinking, oh, I'm only 25, oh, I'm only 31. If you have got a prostate, no matter what your age is, you run the risk of getting prostate cancer. And you should never take the position, I'm too young, because that's not the case. Yes, it's been led to believe through just medical training, etc., that only old men get it, because ultimately as you get older, your prostate will enlarge because you start to reduce the production of testosterone, and with a reduction of testosterone, then ultimately the prostate gets bigger, and that's where you run the risk of obviously developing a cancer, because the cells break down and then reproduce and etc. And that's where we get it from. But it's not the case. I know of children of 8 years old that had prostate cancer and had to have it removed. So it's not just that. So keep an eye on developments with urination, sexual potency, ejaculation, and just pains, family history. Because ultimately what you don't want to do is you don't want to end up like I did at 41-year-old, and now I'm problems with potency, so I need to take a tablet every day for that. I can sometimes have incontinence issues, but I just do regular exercises, and ultimately I have now got cancer again. So you don't really want to go through this if you can keep a top of it, and if you can prevent it. There's lots of things out there that can help you prevent it. You can go to my website, just follow the link in my bio, and you can have a look. And there's a product in there that can help do that. But I just want to let where we're at now. So for 3 years, every 3 months, I had to have a PSA blood test, because although I got told the prostate had a clear surgical margin, the first proper PSA test taken in December, bearing in mind I had the prostate removed in October, showed that I had some prostate specific antigens, i.e. PSA, in my blood. And instead of that being 0.0001 nanograms, it was showing at 0.04. And it's because of that initial results that I had to go on to 3-month monitoring, because that would suggest that actually they didn't get all the prostate cancer away. We went through 3 years of up to 0.7, back down to 0.04, and then slowly but gradually 3 years in, it got to a point where it's gone up to 0.10, and at that point, that's where 7 years ago I was told that I'm not in remission anymore, and the prostate cancer had come back, and it was deemed medically back. But I had various tests done then, what's called staging. So staging is basically trying to determine the size of the cancer by various tests, and in my case it was a bone scan. So that's an injection of nuclear solution into the body. You go under a certain scanner, and then it picks up any metastasization into the bones, mainly for men as prostate cancer sufferers. That will be pelvis, hip, lumbar region of the spine. I also had an MRI scan to sort of get an image of the prostate bed. What I mean by prostate bed is, and a lot of men don't know this, so sometimes I find it difficult to explain just because I think we should do. But the prostate bed is just the other side of the rectum wall. So the prostate sits between your testicles and your rectum wall, and it sits on the rectum wall. Hence, it's a pleasurable thing for men of a certain sexuality because of where it sits. But to remove it, that's why it's one of the most difficult, because one false move and you've got a perforated rectum, and that to try and fix is really difficult, and that's why a lot of men are scared, because they don't want to have a stoma, and rightfully so. I don't want a stoma neither, and I was scared of that when I got told that was my option. I didn't want to have a stoma at 41. But that's where that is. So obviously an MRI scan of the rectum, the prostate bed, to see if there's any developments there, if they could see anything that was growing unusual. They didn't. I think I had a CT scan because I had some pains in my testicles and in my lower back, so they had a CT scan as well of that, and nothing was of note to be found, and it was just heavy monitoring, we call observing the PSA. So for the last 7 years, every 3 months I've had the PSA bloods taken, until about 3 months ago when it had risen to 0.60. Now, I have done everything in my power to avoid this happening. I have moved from a city, Leeds, this is, as you can tell with the accent, probably, to a rural area of southwest Scotland where it's less stressful, very quiet, not running around at 100 miles an hour. I've left a stressful but highly paid job, because stress isn't great for cancer. I have eaten healthily, I've exercised, I have kept my body as fit as I could possibly keep my body. I mean, I'm not an angel, and I have treated myself to chocolate and cake and whatnot. I've also taken CBD oil for the last 7 years, mainly not to stop the cancer, but mainly to counteract the effect of what we call nocturia and dysteria. That is, nocturia, constant urinating during the night, and dysteria during the day. The nocturia one was the biggest problem after my prostate was removed, because I was going to the toilet 10 times in a night. And when you're trying to recover from a major operation and cope with cancer, 10 times a night weeing is not going to get you a good night's sleep. And if you don't get a good night's sleep, then your mental health is not great, but neither will your physical health be great. The NHS gave me a prescription of lactulose and other prescription, I can't remember what it was, I think it was amitriptyline that I took. Didn't stop it, and I didn't really like the side effects of those drugs. They was going to give me steroids, but that meant water retention for hours. I couldn't then go to the gym, swimming, to keep exercise after work, so that wasn't going to be an option. And CBD oil, I'd read, was great at dealing with both those conditions. The upside of that CBD oil was that my anxiety that I've had for many years before the prostate cancer came balanced, and despite the fact that I'm now looking at recurred prostate cancer and further treatment, it did delay, because by rights it should have been years ago that I'd started second stage treatment. So there is some benefits to it, but unfortunately cancer in most people, once it's in your body, it's very difficult for you to survive it. There's not a lot of people that survive cancer, especially when it comes back a second time. So where we're at the moment is I'm waiting for what we call staging again. This is a bone scan, this is an MRI scan, possibly a CT scan, because there's a very high chance that my prostate cancer has metastasized out of the primary site into my testicle. So that's called metastasized prostate cancer into the testicle area, and it may have metastasized into my hip pelvis area, hence the bone scan. And what we're looking at there is one of three, or a combination of three, or just two, but the treatment for each is an orchidectomy for the testicle if it's found that it is cancerous. So as it suggests, it's a removal of the testicle. And I think I'll get a false testicle. There'll also be potentially radiotherapy of the prostate bed if it's found that there is some abnormalities there to sap that. And then if it's in the bone, then we're looking at possible chemotherapy as a treatment for that. How that pans out in life expectancy, I do not know. We haven't even had the staging yet, but that's where I'm at. Now, in relation to the whole process, some people have said, if you'd have got diagnosed earlier, would it have been different? That's a question I had to ask myself, and that's a question that I asked the NHS when I complained to them. Unluckily for the NHS, I worked in medical law when I got diagnosis, so I knew how to write a complaint to make sure I got the best answer from that GP practice in Leeds. Would that intervention, had they known what we know now, had they not just treated me as somebody with depression and a somatisation disorder? Probably not. I might not have needed a prostatectomy, which is quite an invasive procedure. I might have got away with hormone therapy, may have got away with just a zap of radiotherapy, but I think we'd still be here. Other question is, could I not sue the NHS for negligence? I could have done, but I worked for a defence organisation at the time where that was the legal representative of that particular GP practice. So it was very difficult of me to further my career with that defence. That it wouldn't be a good career move to sue them for negligence. Would I have won the negligence? I don't know. There's a lot of things to go through when it comes to clinical negligence. You have to prove duty of care. Then you have to prove, which is easiest to do in patient-doctor relationships, but then you have to prove that duty of care has been breached. Was there any causal links between the breach of the duty of care and the actual outcome? So it's not that easy. And then obviously you have to prove that in a group of peers to the individual that you're accusing of negligence, would that group of peers come to the same conclusion? So the reasonable man test. And it's a very difficult thing to prove in medical negligence. And quite honestly, I just wanted to get over the actual operation, get back to my work, and luckily for me, I managed to progress through my career there and got quite high and got some good qualifications because of it and got some good pay because of it as well. But just putting this video together because there is a lot of activity at the moment around prostate cancer. There is a lot of media attention. There's a lot of celebrities coming out as being diagnosed with prostate cancer, etc. And I just wanted to make this so it's not just celebrities. There is a lot of just ordinary men dealing with prostate cancer. It is a scary thing at the moment for me and people around me, obviously. We don't know where we're at. We don't know what's going to happen. We don't know what treatment I'm going to take. Don't know if they're even going to give me treatment. We don't even know if it's spread. But what we do know is that I have still got within me a cancer that is growing. And at some point, it's going to have to get dealt with. I will try my utmost to avoid, if I can, modern medicine. I'm a great believer in trying alternative solutions in the first instance It's not going to harm. It won't give me any side effects. And there is a lot of evidence that, sorry, I do apologise. There is a lot of evidence that alternative remedies work for a lot of people. I have seen it from myself with females with breast cancer and males with lung cancer, that they do take alternative treatments. And we will look into that first before anything is pushed into my body, removed from my body. But ultimately, I am a balanced individual. I have worked in medical law. I do look at things in a very logical way. If I feel that modern medicine is the best solution, that's the way that we will go. If I think we can try an alternative solution first because time's on our side, then I will try that first, because it's my body and I don't want it to suffer like it has done for the last 10 years, because living with prostate cancer, living with the side effects of having the prostate removed, is difficult to come to terms with. You really do lose your natural potency, and you do need to take tablets if you want to have an active sex life. You do occasionally have an incontinence issue. You do occasionally get fatigue because of that problem, and you always have every blood test that worry that you're going to get told it's back. But you have to look on the bright side, as I have done up until a week ago, where I honestly haven't. But the bright side is that I'm still alive. Yes, I might have some bits and I've got missing from me and I've got scars, but I'm still alive. So I implore men, because there's a lot more men just ignoring this whole prostate thing, going, it won't happen to me, I'm too young. Yeah, that's what I thought initially. And then as I got through that 3 years, I was like, oh, this is definitely going to be prostate cancer. I can feel it in my body. There was something just not right. Yeah, and if I could have taken some form of supplement or remedy that would prevent the prostate cancer, I definitely would do. Definitely go back 15 years and start taking something, no side effects, because I don't want anything that gives me side effects and I have to take multiple medicines to counteract that. But if I could take something that I knew had a great opportunity to reduce prostate cancer, then I would. Because it not only affected me personally, it did have a ripple effect. It affected my relationship with my ex-husband greatly, because I became a patient, he became a carer, and that obviously affects any relationship. It affected the way that I had friendships. It also affected my work relationships. So the ripple effect is far and wide. So just, if you have any questions from anybody, that's any man or any person that knows a man that may be suffering or is at risk, and they're a little bit intimidated by talking to their friends, as they don't really understand all the technical jargon on websites, by all means, drop us a comment. Yeah, subscribe to YouTube as well, and there'll be more of these videos coming through, because I do believe, probably why I joined Prostate Cancer UK as an ambassador, that the more men talk about this, the more men can be saved. Because let me tell you, prostate cancer, when it kills you, is extraordinarily painful. I know men that have died from it, I've watched them. It spreads all round the base of your body, spine, pelvis, and it causes excruciating agony, and not one single painkiller will stop that at all. So do yourself a favour, don't worry about fingers up bums, needles in your arms, or talking to somebody. Just do it.